has joined us from the Maryland Commission for Women as well. Brett, I think you're gonna do the slides for me. Is that right?
Yes.
Perfect. So I'm going to call this meeting to order. My name is Ariana Kelly, for those of you who don't know me, and I'm the Executive Director of the Maryland Commission for Women. This is the first official meeting of the Over-the-Counter Birth Control Collaborative. So thank you, everyone, for volunteering or being voluntold to participate in this exciting collaborative. I'm going to go through a little bit of background with you all, but I don't want to talk for too long. We're going to do introductions, we'll review the agenda, and then we will have a really exciting presentation. So with that, we're going to talk about the background of the OTC Birth Control Collaborative and why we are all here, starting with a little bit of background on the Commission for Women and what we're doing in this capacity. So as Aaliyah Horton just mentioned, the Commission for Women is actually a 60-year-old state agency. We are housed within the Department of Human Services. We were established in 1965. I'm a new executive director. I've been there for the last year. Prior to that, I was in the Maryland General Assembly for 14 years. So I did a lot of healthcare policy work and reproductive healthcare work, which I really enjoyed. And one of the reasons I came to work at the Commission for Women was because they have had a very long-standing support for reproductive health care access. And in fact, the Commission for Women was established in 1965, 60 years ago. They made 200 recommendations to the governor. One of them was to expand family planning access. This was in 1965, the year of Griswold v. Connecticut, for those of you who follow these things. I just wanted to kind of root the Commission for Women and your understanding of the work we're doing a little bit. So I put Senator Verda Welcome on there. For those of you who are Maryland history nerds, she was one of the original commissioners at the Maryland Commission for Women, and she was behind this idea that you can't have a women's rights commission without supporting family planning access. She was also the first Black woman in the Maryland General Assembly and only the second Black senator in any state in the country. So she's really cool, and she wanted us to be doing this here at the Commission for Women, so I'm going to do it. We are an interagency convener and implementing partner for many state agencies in Maryland on women's rights issues. So that's what the Commission for Women does. Thank you, Brett. And I wanted to make sure that everyone knows our commission chair and the subcommittee chair of commissioners who is going to be overseeing this work for us with the commission. So Dr. LaShawn Stitt is our commission chair. I know that Dr. Stitt is on the call. Do you want to say hi, Dr. Stitt? She might be on.
I'm here. Thank you so much, Ariana. Hello, everyone.
So Dr. Stitt is the commission chair, and then we also have a subcommittee chair on our commission named Christine Lee. I know that she had a call that was ending at 2:30, so she may be coming on late. Dr. Lee is actually a pharmacist, and she is chairing our OTC subcommittee of the work that we're doing at the Commission for Women, both with this collaborative and with a grant that we are working on in partnership with the American Society for Emergency Contraception and the Strauss Foundation to make sure we can implement EC and over-the-counter contraception access at community colleges. So we're doing both of those projects at the Commission for Women and really excited about partnering with all of you on the first one, the collaborative work. Thank you. Want to make sure that you all know the commission staff. Again, I'm the executive director. You're going to be hearing through the rest of the meeting, and your main point person is going to be Brett Jordan. She is our program manager for the over-the-counter contraception project. But we also have Genesis Franco, who you met earlier. She's going to be working with you to make sure we get the roster complete. Camille Fabi is here. You want to say hi, Camille? Maybe.
Hi, everyone.
She's off camera, but Camille, and also Taryn Graves is a graduate student assistant we have working on this project. Do you want to say hi, Taryn?
Hi, everybody. Nice to be here.
Excellent. Okay, next slide. We're going to make this real quick, I promise. For those of you who don't do a lot of work in this space, I just wanted to do a little bit of background. So you might not be aware of what over-the-counter contraception is. Just want to make sure we're all on the same page as we have these conversations. Over-the-counter contraception is contraception where you don't need a prescription. So we're talking about Plan B and O-pill, which is the progesterone-only daily birth control pill, and condoms. It is related to, and the conversation we're going to be having as a collaborative is related to, but very different from pharmacist prescribing. So in Maryland, pharmacists can prescribe other forms of contraception that aren't already approved for over-the-counter use. So this conversation is about the contraception that is approved for over-the-counter use. So I wanted to make that distinction and wanted to nail down that we're really talking about making sure that people can access their insurance coverage even though they're getting contraception without a prescription. So this is actually a law that was passed in 2016 in the state of Maryland. It was Senator Dolores Kelly and myself. Pausing for a second to just acknowledge that Senator Dolores Kelly is also a real champion in this space, and she's going to be inducted in the Maryland Women's Hall of Fame this year, in part for this work and for a lot of other work she has done to advance women's rights in Maryland. So I just wanted to note that. This law has been in the books since 2016, but it hasn't been fully implemented. And so that's why we're here. We want to make sure that the intention of the law is really a reality on the ground for consumers. We need to figure out what kinds of barriers or obstacles we need to address so that we can make that a reality. Next slide, please. This is why Chair Pena-Melnick and Senator Hedelman, is Senator Hedelman on the call yet? Has she hopped on?
I haven't seen her pop on.
Okay, she was going to try and join and greet you all. So if she hops on, we will have Brett keeping an eye for her hopping on. If she hops on, we will stop what we're doing. It looks like Allison Taylor also needs to be let in. I just got a text from her. If Senator Hedelman hops on, we'll stop what we're saying and she will greet you all because she was very eager to thank you for your work and your service in this collaborative. So Senator Hedelman and Chair Pena-Melnick passed legislation this year with the goals of bringing together you all, the stakeholders, to brainstorm, analyze, and determine recommendations. You can read a slide, right? We want to make sure that this is working. And we have to do 2 reports. One is due in January 2026, and then another in 2027. So that is our charge. And then I think there's one more slide that really breaks down our specific goals here. This is from the statute, and you all have a copy of the statute in the emails that Brett sent around. The purpose of the collaborative is to study and make recommendations, right? We want to talk about implementing the insurance coverage requirement. We want to talk about advancing point of sale coverage options at retail counters, virtual retail platforms, and vending machines. We want to identify birth control initiatives to increase access to over-the-counter birth control, and also enhance education and engagement of consumers, healthcare practitioners, public health and community programs, and healthcare industry stakeholders. So that's everybody who's here in the room right now. So thank you for being here. Next slide. Everybody got a copy of this agenda. We didn't hear any negative feedback, so I'm going to assume we're okay with it. We're going to do introductions. We're going to introduce our co-chairs. We are going to do a brief mindfulness exercise so we can all make sure we're in the same right headspace for this work. And then we're going to have a wonderful presentation on the origin of the collaborative and the work of Free the Pill, and then talk about next steps related to our interim report. And with that, I believe I am passing it off to Brett Jordan. So thank you all for being here. Again, I apologize in advance if we cut off whoever is speaking, if Senator Hedelman does hop on. And with that, Pat, take it away, Brett.
Great. Thank you so much, Ariana. Good afternoon, everyone. We are so excited to have you all here today for our first official meeting. I'm going to take care of a couple of logistics first, a little bit of housekeeping, ground rules, talk about our meetings and reports, which are the 2 primary pieces of work of the collaborative at this point. So our plan is to meet on a quarterly basis after this calendar year. So we are hoping to get another meeting in, not hoping, we will get another meeting in November to get a little bit more really substantive work done before our first report is due at the very end of December, January 1st, December 31st, and we will talk about the report a little bit more at the end, but this is just a little bit of an overview of what's going on. So the purpose of our meetings, we're going to have presentations from experts. We're going to have discussion of of what has been brought to our attention, ideas that people have, and then we are going to establish recommendations for what we want to ask the General Assembly and or executive agencies to do. And so that is what is going to go into, that is going to form the meat of our reports. So as it says here, collaborative members may suggest agenda items and experts that they wish to hear from, and will absolutely be expected to share your opinions and weigh in on proposed recommendations. We have an incredible group of people in this virtual room who are absolutely brilliant and have so much expertise that we are truly relying on in order to get this done. So a little bit about the reports. The commission staff will be drafting the reports. Collaborative members will have the opportunity to send us comments on what they see in specifically the section regarding collaborative activities, and to review those pieces of the reports before they are submitted to the General Assembly in January or at the end of December. We're hoping to run a little bit early and get it in plenty of time. So the purpose of our reports are to raise awareness of access issues, so find those barriers that Ariana was talking about, and offer concrete recommendations to the General Assembly and executive agencies regarding how to overcome those barriers. Are there any brief questions at this time? Okay, we're going to move on to our next slide. So next up, we have introductions. So we are going to ask everyone to go through and share their name and their title and organization. If you would like to put this in the chat, you may. You may also share it verbally. We're going to try and keep this brief. If there's anything other than your name and title and organization that you wish to share with the group, you are more than welcome to put it in the chat. So not to jump ahead of ourselves a little bit, but I'm going to ask our co-chairs to start. So Aaliyah, can you start, please?
Hi, good afternoon. My name is Aaliyah Horton. I am the Executive Director of the Maryland Pharmacists Association.
Thank you, Aaliyah. And Cynthia?
Hi, everyone. I'm Cynthia Bauer. I'm Director of the Horowitz Center for Health Literacy at the University of Maryland School of Public Health in College Park.
Wonderful. Thank you both so much. All right, I'm going to move through alphabetically by who I can see here on my screen. So Allison.
Hi, Allison Taylor, Head of Government Relations at Kaiser Permanente, representing the League of Life and Health Insurers.
Wonderful. Thank you. Becca Elaine.
Hi, I'm Beth Lane, and I'm the Senior Health Policy Analyst for MHBE, or the Maryland Health Benefit Exchange. Thanks.
Wonderful. Thank you. Bria.
Sorry, I'm recovering from a sickness. Hi, everyone. My name is Bria. I'm Senior Policy Advocacy and Research Manager from on the Free the Pill team at IVIS Reproductive Health.
Okay. Actually, my apologies. We're going to I called on you. We're going to just do the collaborative members for the rest of this. So Kaylee.
Hi, everybody. Kaylee Locklear, the Maryland Association of Chain Drug Stores.
Okay, thank you. Christina.
Hi, everyone. Christina Pecora. My pronouns are she and her, and I'm a senior policy analyst at the National Health Law Program.
Delia.
Hi, my name is Delia Angulo Chen. I'm the representative for Advocates for Youth on the Free the Pill Youth Council.
Jakia.
Hi, everyone. I'm Jakia, Executive Director of Reproductive Justice Maryland.
Wonderful. I believe Joe told me that he wouldn't be able to speak, so he has added his in the chat. Joy.
Hi, good afternoon, everyone. Pleasure to be here. I'm a physician program specialist with the Maryland Department of Health, formerly in long-term services and supports, and I'm one of the medical directors with the about 2-year-old clinical transformation unit under Dr. Gingy Lindsay.
Great, thank you. Kelly.
Hi, everyone. I'm Kelly Cleland, she, her. I'm the Executive Director at the American Society for Emergency Contraception.
Great, thank you. Krista.
Hi, everybody. My name is Krista Hine. I'm the Manager of Patient Care Services for Albertsons, and I oversee all of our prescribing and point-of-care testing services for our pharmacies, and I'm also a pharmacist.
Wonderful, thank you. Neil.
Hey everybody, Neil McGarvey, owner of Professional Pharmacy Group, pharmacist, and I'm in Anne Arundel County primarily, 5 pharmacies. Thank you.
Great, thank you. Penny.
Hi, I'm Penny Jacobs. I'm a family nurse practitioner, and I manage the GYN reproductive, sexual, and gender health programs at the University of Maryland Student Health Center in College Park.
Great, thank you. I hope I'm pronouncing this correctly. Philemon?
Yeah, Phil Kondrowski here today on behalf of the League of Life and Health Insurers. Our executive director, Matt Celentano, couldn't make this meeting, but I'm here on his behalf today.
Great, thank you. Sabrina.
Hi, my name is Sabrina, and I'm one of the assistant chief investigators with the Maryland Insurance Administration.
Wonderful, thank you. Samantha.
Hi, everyone. Samantha Ritter, she, her pronouns. I am the director of the Office of Family and Community Health Services within the Maternal and Child Health Bureau at the Maryland Department of Health.
Thank you. And Victoria.
Hi, everyone. Victoria Nichols, she, her pronouns. I'm the Senior Project Director for Free the Pill at IBIS Reproductive Health.
I believe Senator Hedelman just hopped on, so fantastic timing. We'll give her 1 second to join. Senator Hedelman, welcome.
Did she come in and out at the same time?
Hopefully she's not having technical difficulties.
Hi, everybody. Can you see me or hear me?
We can, thank you. You have perfect timing. We just did introductions.
Okay, I am so sorry. I'm having a little technical difficulties and then I'm racing off to a meeting, but I just wanted to say how happy I am to see everybody in your little boxes that I can see, and want to just say congratulations to you all. This is such a fabulous work group. You have such an important task ahead. As so many of you, hopefully all of you know, the many tremendous contributions that First Delegate, then Senator Ariana Kelly made to so many women's lives, so much about reproductive health care. And what unfortunately we know all too often as legislators is that in getting a bill passed is hard enough, and making the stars and the moon align to get your colleagues to see the wisdom of legislation, to get 188 of our colleagues, 187 of our colleagues to support it, the governor to sign it. And then what no one ever told me before I was elected is how much work it takes to actually make sure that what your vision is happening and is implemented, is enacted. And unfortunately, that's what happened here. That we all know how important contraceptive equity is. And you all are going to make sure that it happens. And you all are going to come together and work with government and all of the stakeholders that are so critical to making it a reality actually happen. So I just want to say thank you so much to Ariana Kelly, and thank you to so much to all of you for, I know, all of the hard, diligent work you are going to put in to make such an important difference in so many people's healthcare and so many people's lives. So thank you, and go off and do great work. I know you will.
Thank you, Senator Hedelman. We really appreciate you stopping in and greeting us. Thank you so much. I know you're so busy today.
Take care. Thank you. Be well. Bye-bye.
All right, wonderful. It was wonderful to hear from Senator Hedelman. And we will move forward in our slides. So next, just very briefly, I already gave it away. We have two fantastic co-chairs who are going to be leading us and taking a lot of the lead on facilitation and meetings going forward. Cynthia Bauer from the Horowitz Center for Health Literacy at the University of Maryland, and Aaliyah Horton, Executive Director of the Maryland Pharmacists Association. So I know we're all on mute, but a quick applause for our co-chairs and all the fantastic work that they're going to lead. So I'm actually going to turn it over to our co-chairs if you would like to do our mindfulness exercise.
Sure. Aaliyah, would you like to speak first?
You're on the mic. Go ahead.
Okay, great. Well, hello, everyone. Aaliyah and I are super excited to be here co-chairing this activity with you. And we wanted to just get people kind of, as Brett said, in the headspace for what we're going to be talking about today and going forward. So we would like you just to put some thoughts in the chat in response to these two questions. What does full OTC contraceptive access look like in your world? We know people come from many different perspectives here. And how does it impact, benefit Maryland consumers? And then we'll ask for a couple of volunteers just to talk about their responses. So if you just take a second and put these in the chat, that would be great.
I'm sure everyone is thinking very hard about this.
This should be an easy question. As I say, this should be a softball question for everybody in this group.
Thank you, Jakia, for being first out of the gate.
Yes. Yeah, we're seeing the variety here of how it looks in different people's worlds. Yeah, these are great responses. Is anyone interested in sharing aloud 1 or 2 sentences about what they're interested in and what they put in the chat?
Hi, I think just to ensure that people have access with a parity of cost. Often I hear on my end working in Medicaid that people get frustrated like, oh, well, Medicaid gets that for $2 or $3 or no pay, and I have to pay $20 to $50 for it. And this is, you know, a reproductive health issue that affects all people with uterus, whether you have Medicaid, private insurance, or no insurance. And so to keep the parity across the board, not to disincentivize people with Medicaid to have to pay more or penalize people with insurance, but to have everybody have the same access and have it be low cost, quite frankly.
Wonderful, thank you. Do we have one more volunteer? Oh, Sabrina, that's a great point. Parents. Parental permission.
This is Cynthia. Since one of the reasons I think I'm on this group is to talk about the consumer education and outreach. My answer really reflects our experience that even when benefits and services are available and affordable, they're not necessarily fully accessible because people don't know about them or understand how to use them or where to find them. So I think for me, full contraceptive access is both the affordability piece, but also that people know about, understand, and actually have the concrete information they can get what they need and want.
Absolutely, thank you. All right, in the interest of time, I'm going to move to the next slide, but these are fantastic answers, everyone. Thank you. All right, I'm going to turn it over to our fantastic team from IBIS and Public Policy Partners to talk to us a little bit about Free the Pill and the collaborative.
Hi, Brett. Just logistics. I've got slides. Can I share? I think
I'm muted. Absolutely. 1 second. Let me make you a co-host so you're able to do that.
Okay.
And Robin, we didn't have a chance to do introductions for our presenters. So if you would like to just tell us who you are and what brought you here.
Sure. So many of you know me as an advocate here in Maryland. I'm not actually in that capacity today. And I just to tell a little bit of a story. I was an advocate involved with the 2016 bill with then Delegate Ariana Kelly and Senator Kelly that established Maryland as the first state to require OTC coverage in the state regulated market. So after that, we will be hearing from Free the Pill today. I joined the team of Free the Pill as a consultant and have been working on OTC implementation policy ever since. And you'll be hearing more from me about that. But for now, I'd like to just check if you can see my screen. No, yes.
You can.
Okay.
We
I
can,
never know
but
with
it's the last slide.
It's the last slide. Okay, I will go fix that and I will hand it over to my colleagues, Victoria and Bree.
Hi, everyone. It's so great to be with you today. I'm really honored to be a part of this fantastic group and excited to move forward with implementing a law policy that's been on the books for a long time, and it's such a great model for many other states. I'm joined by my colleague, Bree Good. Bree, if you can wave, and Bree's going to have some slides a little bit later. And Robin, I don't know if there's a way for you to do full screen share.
Yes, I'm going to do that, but I am not going to be able to see anything else.
Okay.
So if you could cue me when there's a question or something in the chat, that would be great.
Sure. That sounds good. And I'm Victoria Nichols. I introduced myself before, but I'm the Senior Project Director for Free the Pill. And my colleague Bree Good is joining, who's the Senior Policy Research and Advocacy Manager. And it's been just such a joy to work with Robin for so many years on this work. If you could go to the next slide, please, Robin. I have a couple of slides on Free the Pill. So Free the Pill is a coalition and a campaign. We started off as the Oral Contraceptives Over-the-Counter Working Group and began work in 2004 to figure out whether birth control could become over-the-counter in the United States. Over 100 countries had already done it, had pills over-the-counter for consumers in their countries. And it took about 2 decades of research, building the evidence around this. IBIS Reproductive Health, which houses Free the Pill as a research organization, so spent a lot of time addressing really important questions about safety and effectiveness with partners in our coalition, as well as advocacy to get this over the counter. We are a 250 plus member organization, coalition of reproductive health rights and justice organizations, youth activists, healthcare providers, researchers, and much more, medical associations as well. And we've been working on this for a long time, and we're really thrilled to have OPIL over the counter in the US, and our work doesn't stop there, both on insurance coverage and affordability, but also ensuring that other pills become over the counter in the future. I think I have one more slide, and then I'm going to hand it over to Bree. And just wanted to share that our work is really rooted in reproductive justice values, which means we're focusing on the people who could benefit the most from over-the-counter birth control pills and who face the most barriers in our healthcare system and our society. We know that a lot of this is due to systemic inequities that are rooted in systemic racism, structural barriers, geographic barriers, and other forms of oppression that really drive contraceptive inequities. And over-the-counter birth control pills really have a key role to play in addressing a lot of those inequities because they disrupt the prescription barrier and make it a lot easier for people to access birth control pills in their communities without having to schedule an appointment with a provider, wait for that appointment, pay for travel or childcare to get to that appointment, etc. And we know that these issues disproportionately impact communities of color, Native and Indigenous people, young people, people working to make ends meet, people with disabilities or rural communities. And so this has been a really core part of our work to ensure that over-the-counter birth control pills just doesn't just reach people who would have already had access regardless, but that it's reaching people who have the most barriers. And insurance coverage is a really key part of that work as well. I'm going to hand it over to Bree to cover the next couple of slides. And I think actually, Robin, this was your slide, and then we hand it over to Bree.
Oh, thank you. So we had some objectives for today. There is so much more material, but we thought we'd help ground the discussion on some of the basics and really build on what Ariana started with, which is providing an overview of what OTC birth control is, including answering some questions about what the FDA process is for considering something to be over the counter, the different kinds of access models, and how does OTC birth control support reproductive justice. And then we are going to get into some specifics about OTC coverage, the insurance coverage itself. We're going to talk about what's happening across the country in terms of OTC coverage laws, what Free the Pill has done in terms of supporting states and perhaps eventually a federal solution with implementation. And then really what is the role of Maryland and all of you here today, what Maryland can accomplish. So it's exciting to be here, and I'm going to hand it over to Bree. Oh, is this you, Bree?
See you, Robin.
It's me? Okay. All right. So this is building on what Ariana started out with, is what methods of birth control are considered over the counter today. And just generally grounding our conversation is that the FDA has two categories of products it approves. One is medications, and one are devices. And this is true beyond birth control. So on the medication side, we've had Plan B, and now it's generics, has been approved since 1999. And then there has been removal. Some of you may think and have in the back of your mind, is there an age restriction? That was the case when it first started, but has been removed for a long time. And we actually have an expert on the collaborative who can answer all those questions. Just a shout out to Kelly Cleland. O-pill, which is the first daily birth control pill that is over the counter. We're going to hear more about that from Bree and Victoria. But that is like the pill pack that everyone thinks of as birth control pills. And so that's now been over the counter and on the shelves for approved for 2 years, and on the shelves we're approaching a year and a half. Then I just wanted to mention, we don't usually talk about it much, but spermicide is over the counter and it is considered a medication. And so it's not usually readily available on the retail level, but just wanted to acknowledge that it is considered a medication. So states that require coverage of OTC birth control medications also cover spermicide. Then we have 2 OTC birth control devices, and those are what we commonly refer to as male condoms, which can be also referred to as external condoms, and then female condoms that are internal condoms. There are a number of devices that are prescription, like diaphragms, IUDs, implants, but for now we've got 2 OTC birth control devices. And so now I'm going to turn it over to Bree and Victoria.
Thank you, Robin. And please bear with me as I'm recovering from a cold, so my voice may go in and out. But I'm really glad to be here with you all today. As Victoria mentioned, I'm the Senior Policy Advocacy and Research Manager on the Free the Pill team at IBIS. And I'm going to take a minute to walk us through what the FDA process looks like when moving a prescription medication over the counter. And so in order to bring any pharmaceutical over the counter in a way that is equitable and accessible, you have to partner with a pharmaceutical company. And so in 2015, IBIS and Free the Pill did an open call to pharmaceutical partners. And at the time of the open call, HRA Pharma, which is now formerly known as Perrigo, had a progesterone-only pill that they had manufactured, and they responded to our call for partnerships. And so the company had to align on some core values for us to establish a partnership with them. And that included a commitment to a product without an age restriction and that it was covered by insurance, and the importance of investing for all people to be able to afford it. And once the product was approved. So after aligning on those core values, we established a partnership with them in 2016. And then in December of 2016, IBIS began some research projects to conduct a couple of different studies to help HRA Pharma at the time submit their application to the FDA. Next slide, please. So this kind of goes step by step of what the regulatory process looks like. And in order to make a pill available over the counter, it requires a number of research projects and research studies that demonstrate a couple of different things. So first is to make sure that it is safe and that it is effective. And then there are also other studies here that need to be met in order for it to be considered an over-the-counter product, right? So there is a label comprehension studies, which essentially prove, can people understand how to use the product when they read the drug facts label on the back of the pack? There's self-selection studies, meaning are people able to determine whether or not they are eligible to take a certain medication, whether it is right for them without the advice of a healthcare provider. And then there are actual use studies, which explains, can people actually use the product in a way that it is described on the label? And how does that behavior kind of show across different consumers and different behaviors? And so once that research is completed, application is submitted and filed to the FDA. And then the agency takes anywhere up to 10 months to make a decision on whether to approve the product for OTC use. And during that time period, they normally convene an advisory committee to hear expert advice and public testimonies. And so the advisory committee is made up of outside experts. So that can include physicians, researchers, clinicians, statisticians. And so essentially it is no one on the FDA itself. And then they also have a portion of the advisory committee that the public can engage in, so people can submit virtual testimonies, written testimonies, verbal testimonies, and that plays a part into the overall decision along with the research and the input from the advisory committee themselves. And that essentially drives the final decision on whether or not to approve an application to go over the counter. You can go to the next slide for me. Thank you. And so this slide essentially depicts what the FDA regulatory timeline looked like specifically for Opill. So HRA Pharma submitted an application in 2022, and then there was an advisory committee that was scheduled around November of 2022, but then it was rescheduled for May. And so that is when the official advisory committee had convened and heard testimonies for bringing Opill over the counter. And it was a 2-day process on May 9th and May 10th. Next slide, please. So on May 9th and May 10th, we had Free the Pill had over 30 partners testify to the importance of over-the-counter birth control. And there were hundreds of written testimonies that were submitted as well, which were largely from young people on college campuses. And that spoke volumes just to the overall support for over-the-counter birth control. And we also held a rally in DC to gain the public support as well. And so this really helped with in tandem with the research that IBIS conducted with HRA Pharma, essentially drove the decision to have the FDA advisory committee vote unanimously to recommend Opill for approval, which was huge for us. You can go to the next slide. And so once the advisory committee had recommended for Opill to move over the counter, the FDA itself as a whole on July 13th, 2023, approved Opill as the first over-the-counter birth control for use. And this was a really huge movement-driven win for the Free the Pill Coalition. As Victoria had mentioned before, it was over 20 years of advocacy and research and dedication that was given to this process. And so having this win really amplified and also just really acknowledge all the work that we, as well as young people and consumers and people, our partners, have put into this process. And so after the FDA approved Opill for OTC use, it became available online and at major retailer stores in March of 2024. The next slide. So I want to kind of touch on just the wide range of support for over-the-counter birth control. And this ranges from community members to policymakers to state advocates and everything in between. And so over-the-counter birth control pills are widely supported by the general public. So that includes birth control users, youth advocates, reproductive justice leaders. I do want to emphasize that 70% of women of reproductive age support making birth control available over the counter without a prescription. And reproductive health organizations and rights and justice organizations have been researching and mobilizing for decades to expand access to over-the-counter birth control. And on top of that, with community-based organizations and state and federal advocates, there are also a lot of providers and health associations that have advocated for over-the-counter birth control pills, and that includes major medical organizations like the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists, and the American Medical Association. And they have all essentially stated that over-the-counter birth control pills are safe, they are effective, and they are beneficial to the overall health and well-being of the community. And also highlighting researchers and policymakers as well. So we have really, really broad support, and I'm sure many of you who are also on this committee support over-the-counter birth control pills as you were invited here. So I will pass it over to Victoria to continue us with the presentation.
I think this is your slide, Robin.
Yes, so Victoria, Bree, and I have been really supporting OTC models of access in many states and on the federal level. And what is really key, and Ariana really touched upon this, is OTC birth control is a different access model than many of us are used to thinking about. And there are really 3 ways that people access birth control. The first way is one that we think about usually. It's kind of the traditional way, and that is the office visit model. And that requires an individual to see a provider either in an bricks and mortar office or now a telehealth office. And the provider evaluates the individual and then prescribes the appropriate birth control method in consultation and collaboration with the consumer. It is intended to be a joint decision arrangement. Once the consumer has a birth control prescription, and if it's a medication, they have to get that from a pharmacy. Pharmacists dispense the medication as a prescription. They have to meet very, very substantial federal and state dispensing rules, ranging from record keeping to what goes on the label. There is a bit of an exception here that I just wanted to note, that public health clinics, such as Title X clinics, can dispense on site. They also have to meet a lot of rules. Bottom line, what this means for the consumer is that they can get access to birth control, but they must have gone through some type of office visit and they must have a prescription. You know, the next kind of wave of access models that many of us have heard about, we fall into the pharmacist access model. And there's several different types. Pharmacists can dispense prescriptions, medication under a collaborative agreement with a physician or nurse practitioner. Maryland actually has a pharmacist collaborative model in place. Although, like many states, usually the evaluation is the impact is somewhat limited, given all the requirements of a model. Next is that pharmacists can dispense any kind of medication or a device under a standing order. We think of this most often with Narcan is the example that we're most familiar with, which there is a standing order, there is a prescription. It is from usually the Secretary of Health or a state's medical officer. And then pharmacists dispense the medication and it's under a prescription model though. And then the last model is something that Maryland has had since 2018, thanks to Senator Shelley Heddleman, who was the bill sponsor, who we heard from earlier, is that pharmacists actually can prescribe contraception. And so that really promises to open up access and has done so in several key communities across the state. And that also needs some implementation work. And so maybe some of our work here with OTC can help launch more comprehensive implementation of pharmacist prescribing. But what pharmacist access models mean for the consumer is that they still must have a prescription of some type, and they must have some kind of clinical interaction with a pharmacist. It can range from looking like a regular visit to a more simple dispensing under a standing order, but it still has the same elements as a prescription. Now moving into an OTC model, and this is really where birth control access can change. We can see transformation. And that is the FDA, as we've heard from Bree, goes through a process, determines that an OTC product can be, or a product can be over the counter. And then once that FDA makes that decision, that product can be available at any retailer. That means a convenience store. It means the retail side of a pharmacy. It means a grocery store, online. It means a vending machine. Anywhere where you can get retail products, the retailers can provide OTC contraception. And the idea is that a clinician is not needed because, as we heard from Bree, all the testing goes down to whether or not consumers can read a label and use OTC medication correctly. That's true for Advil, it's true for contraception, it's true for many products. And this is where it gets really transformative for the consumer. They do not need an office visit, they do not need a prescription. There are so many barriers removed. However, as currently insurance is set up for over-the-counter, not just contraception, but other over-the-counter medications, is that the consumer still needs to obtain coverage at the pharmacy counter. And this is something you all may want to talk about more in depth as you go through, but essentially the consumer gets it off the shelf, goes back to the pharmacy counter, because that's the only place where the claim can be processed. So just going to talk a little bit about Maryland as the first state with over-the-counter coverage. This also builds on what Ariana talked about initially. Really, very early on, our Medicaid program was very proactive. And for a long time, and we couldn't even figure out exactly how long, but it was at least 5 years before 2016, Medicaid covers Plan B and its generics, as well as male condoms without a prescription. And so that was very, very forward thinking. And so then in 2016, through legislation, Maryland became the first state to require over-the-counter birth control medications covered in state-regulated plans. I just want to put an asterisk to note that coverage of over-the-counter devices, which are condoms, are not included. And then in 2018, with legislation from then Delegate Shelley Heddleman and Senator Dolores Kelly, Maryland extended this coverage to individuals covered by the state employees plan. So just a little bit about the landscape of over-the-counter coverage laws. We are so excited to say we now have 11 states with over-the-counter coverage laws, with Maine being the 11th state, and that was just signed into law in July. So this is a chart that Free the Pill keeps up. It's probably little on your screen. So this can be in materials that are provided to you. But just to give you a sense, we've got California, Colorado, Delaware, Illinois, Maine, Maryland, New Jersey, New Mexico, New York, Oregon, and Washington. Most of those laws, all of those laws, I should say, cover the state-regulated commercial market. Some of them cover Medicaid, some of them don't, like in the case of Maryland, because Medicaid already covered over-the-counter birth control. A few do state employees' health plan. Just to note that many of the early states that passed over-the-counter coverage laws only focused on over-the-counter medication. But as people got used to over-the-counter coverage laws, most of the later states that have passed such laws now include coverage of OTC devices, which in the case of birth control are condoms. So, all right. Bringing this forward, Bria and Victoria, I could do this slide, or you all could. Just let me know.
Keep rolling, Rob. You can keep going.
All right, keep rolling. All right, so Free the Pill looked at all the activity that was happening across the country, really driven by state advocates, including advocacy organizations and their legislative champions, and really thought we need to pull all of this together, learn from the state experience, and make recommendations on how to actually implement coverage. So Free the Pill formed the OTC Coverage Implementation Collaborative. It's a very similar name to this Maryland Collaborative, and pulled together, again, as Bree lifted up, the focus, the cornerstone was on reproductive justice and consumer advocates. This has to work for people in all communities, and particularly those in communities that have been marginalized from our healthcare system. We also pulled in regulatory and billing experts, pharmacists, and policy analysts. And our focus was to get really, really concrete on how to implement OTC coverage, and to advise both our state and federal partners on OTC coverage implementation. So just a few highlights. I know you all are just getting started, so we wanted to offer at Free the Pill to come back and delve into the very details of OTC coverage and how it can be implemented as you all go through the process, but wanted to hit some key highlights. The first is after OPIL really started to hit the shelf, CVS Caremark, which is, of course, the largest PBM in the country, issued billing guidance for OPIL to pharmacists. And as you go through your work, I'm imagining that one of the #1 questions will come up is how in the world can pharmacies bill for an OTC product? Does it look like prescriptions? How does it work? Well, CVS Caremark answered that question with this guidance, which has really become the industry standard. The second thing I wanted to mention is that Health and Human Services in October 2024 issued a proposed rule which would have made OTC birth control coverage required for most ACA plans. Obviously, the federal landscape has changed and the rule was withdrawn. But if we go back and we look at that rule, proposed rule, as well as the hundreds of comments made on that proposed rule, it really provides a roadmap for broadening and implementing OTC coverage. And then the last thing I wanted to mention is after about 18 months of meeting, Free the Pill, this implementation collaborative that we pulled together, released a comprehensive report on recommendations not that long ago in last November. This has incredibly concrete recommendations, including a checklist for state officials that this collaborative may find very useful. And at some point, we are happy to spend more time on any of those recommendations. And just in closing, we're so happy to be here because Maryland has been a leader on reproductive health access and the leader on over-the-counter birth control coverage. Free the Pill in this implementation collaborative, its #1 recommendation was that state agencies play a critical role in being the convener of stakeholders to actually get down to the brass tacks of things like how do we let pharmacists know how to bill for an OTC product. Many states, I can say, we work with states all over the country that have laws or are interested in implementing coverage policies. Everyone talks about Maryland and looks to Maryland for implementation. So really wanted to thank you all for your commitment to seeing this work through. And finally, just wanted to close on the reason, as Bree lifted up and Victoria lifted up, the reason that we are doing this work is that OTC birth control pill really, and Plan B and condoms really meet people where they are. They don't have to go to an office visit. They don't have to find an open pharmacy. They can go anywhere, any retail setting, including online, where OTC products are generally available. So this is really transformative. And so with that, we wanted to leave time for questions. I'm going to stop sharing my screen so that I can see everyone. And then we are happy to send these slides out so that you all can see it, but you can see lots of ways, either through this collaborative that you all are in, or if you wanted to sign up for separate updates from Free the Pill, there's lots of ways to do that. So thank you so much. And we are going to pause for questions. I think we have a few minutes. Brett, I know you're the timekeeper.
Yes, we do. We have a few minutes for questions. And I'm happy to send both sets of slides out together along with the roster following the meeting.
Great.
Ariana, go ahead.
I wanted to wait and see if any collaborative members had questions, but while I wait for you to raise your hands, I will ask my question. Your second to last slide, thank you for an awesome presentation. This was really great. Your second to last slide mentioned the proposed federal rule and mentioned the Free the Pill report, both of which are actually specifically in our statutory mandate. So I wanted the collaborative members to know we're going to be talking about those things in upcoming meetings. The third thing on that slide was the mention of the CVS guidance. So I guess this is a question, I don't know if it's to Victoria or to Robin, but that guidance, that is, if I understand correctly, Brett sent the sample guidance out to all the collaborative members. So when you're saying CVS is the gold standard, their guidance is the gold standard, that's what we're talking about, the document that we had shared with the collaborative members?
That's correct. So, what that guidance says is that when pharmacists bill and process a claim for OTC birth control, lifting up O-pill, how they should do it. And it's all the technical information about what codes to put in what fields. Luckily it's like maybe even a fifth of a page. It's very, very short, shows that it's very simple. That really helps kind of lift up what is a really good way to bill for OTC contraception for our pharmacist community.
And I think Robin, just to add on to that, the guidance specifically says no, a prescription is not required in like all caps, which I think is really helpful. And then it lists the actual NPI number information that you're supposed to put in, which we've heard from pharmacist colleagues that is what they need to process any claims. And without it, they're kind of unsure about whether they're going to get sued or whether they're going to be liable for things. So that information being really clear is helpful.
And speaking of our pharmacist colleagues, Aaliyah, you have your hand raised.
Hi, thank you, Robin and all, for the presentation. You actually answered some of the questions that I had prior to coming into the meeting, so thank you for being comprehensive. One thing that I did want to mention is with that CVS document, it's CVS Caremark, so it's one of the larger pharmacy benefit managers. So there are other insurers that may be using other PBMs, and so we don't know what that process is across the board. In my brief conversation sort of leading up to this meeting, it was very interesting connecting with some of my pharmacist members or in the independent space as well as the chain space. Every response to that document was different in how the process is implemented. Some were not aware of it. And then talking to friends and family about this collaborative, it was very clear that people were not aware of the coverage. So I do think that the work of the commission is very important, and our outcomes of how we communicate this information is going to be really important because there's a lack of clarity. And so I think this is a great opportunity. One of the comments that I put in the chat was just getting consistency for when patients enter pharmacies and what their expectations are. So just looking forward to the continued dialogue, but just wanted to mention that on the Caremark piece that they do have a large market, but we want to make sure that our other carriers and PBMs are consistent as well, if that's where we're going to go.
Aaliyah, so right in line with your thoughts is the, after recommending state agencies do some convenings, the second number one recommendation that Free the Pill has is that states support consistent, uniform models for billing. The CVS Caremark is a good starting point. There are a couple different other ways to do it, but it seems to be the simplest one as long as there's explanation of how to do it. And so, yes, thank you for lifting up the need for consistency That is what we also hear from literally every other state that has OTC coverage. That's the number one thing we hear.
Thank you. That was a great question. A universal NPI number. That'd be great. Any other questions? We have a couple more minutes for maybe 1 or 2 more questions regarding this presentation. You're also welcome to put questions in the chat.
Well, this is Cynthia. I'll jump in. I was on the FDA advisory committee that took the vote for OTC decision. And one of the things that really struck me about the conversation was the focus on access when a lot of the questions were about consumer understanding of information. And was the information that had been provided so far or could be provided going to be sufficient for a wide range of consumers? And I know that is going to be part of our charge, providing recommendations in that space. So I think that's one thing that I would just like to kind of, queue up for discussion, is sort of how we're going to balance our recommendations across all of the categories that we have, because I do know that access can take a lot of attention, and how things get paid for in the healthcare system, is a huge issue for everyone concerned. And so, just having people think across the range of topics that we have to consider, because I think what I saw in the advisory committee discussion was a lot of emphasis on certain parts of the challenge with making this product category available to people, and less attention to the actual communication piece. And there is research on how consumers understand drug facts labels, or understand what different products are appropriate and whatnot. So I hope we get the opportunity to kind of bring some of that information into our conversation as well.
Absolutely. That's part of our mandate, is to do that public communication piece and figure out how to meet people where they are, to ensure they're getting all the information possible. Oh, thank you, Bree. All right, Joy.
Hey, thanks for that great presentation and information. I think it's a good starting point. As a family physician, I just want to put my 2 cents in that everyone's familiar with those 7 deadly last words of any organization. We've never done it that way before. And there's a lot of emphasis put on consumer education, consumer selection, comprehensibility of self-selection, et cetera, pharmacists, how it's going to get paid, all the wonderful things and challenges and barriers that the research has been done. And I imagine, Cynthia, that there was a lot of discussion about the safety, obviously, with the approval process, but I don't think as a physician that there's been necessarily appropriate trickle down to medical professionals, that there's going to be and continues to be a lot of pushback of but is it safe? And so it's not necessarily just the payment and the consumers that are the issue, but actually the physicians and the other prescribers, nurse practitioners, PAs, whoever is prescribing and in the habit of prescribing contraceptives, that needs to be aware of the new information, the new safety data, and the new possibilities.
That's a great point. We often hear a lot of, okay, but we're used to the side of things where it's not necessarily safe to be OTC. How do we move from there? That's a great point. All right. If anybody has further questions, and for the interest of time, please put them in the chat. We will be recording all questions that are in the chat, and following up. If they're not questions we can answer right away. And so I am going to thank you so much to Robin, Bree, and Victoria for that wonderful presentation. And we're going to move on to our, I guess, second to last piece, which is talking about our interim report, which is our first, first big deliverable for the collaborative, as it is due, as I said, at the end of December of this year. So I'll talk a little bit more about that. I decided to work backwards so you can see the process of how this is going to go. So our absolute can't move, has to be done deadline is that this report is due to the legislature on January 1st of 2026 at the latest. So we're getting sign off from our co-chairs, our wonderful co-chairs on December 19th. So we have plenty of time to make any changes that need to be made and get this in, dealing with technical difficulties, things about that. Yes, yes, as Ariana put in the chat, this is the interim report only. This is not the final report. The final report will be next year. So the collaborative member review, yes, most of the actual activities of the collaborative will take place in calendar year 2026. So we would love for collaborative members to take a look at specifically the planned activities section, as well as what we discuss in this meeting and our November meeting, to make sure that we are really capturing what you have said, what we have said accurately. So we will have a review window of December 8th through 15th. If you have comments, if you have concerns, questions, etc., those will go to me. I believe you all have my contact information, but it is on our final slide as well. And so before that, before it gets to you all, it will go through Maryland Commission for Women review over around that Thanksgiving period from November 24th to December 3rd. So again, we have a little bit of time to complete edits before it goes out to collaborative members on the 8th. And then, so my draft for internal review will be completed November 21st. Again, as I said before, staff will be doing the drafting. If you have things that you would like to be included in our next meeting, or that you really want to have included in the interim report, please send those to me. We are always interested to hear from our incredible collaborative members about what we should be focusing on. So that's just a little bit of a snapshot of what's coming up with this interim report. So as I said, you will have that window of December 8th through 15th to take a look at the report after it has gone through internal review of the Commission for Women, and to give us your thoughts and questions at that time. And then I believe, actually, and before I move to the next slide, are there any questions about the interim report right now? And just to reiterate, this interim report will talk a lot about what the collaborative plans to do, and we will have a significant number of presentations and meetings next year, as well as in November, to really do that substantive work and have a lot of recommendations, really solid recommendations for the final report that is due in 2027. So I will go to our final slide, next steps. I believe I'm taking this, or our co-chairs might be interested, but I'll just share, we will be scheduling our November meeting. So again, starting in 2026, throughout 2026, we will be meeting quarterly. We did want to have another meeting before the interim report is due. So you'll be hearing about that very shortly, as it is already October. Again, this is my contact information here. We will be sending out slides. Genesis, as Ariana said, Genesis from our team will be reaching out regarding the best contact telephone numbers for you all, so that we are able to contact you on short notice as necessary. We will also, once we have all that information, we will be sharing out the full contact list and roster of members of the collaborative, and other pieces as needed. So any questions on what comes next? Or general questions regarding the collaborative? This is the time. Yes, Ariana.
I just want to take the opportunity while people raise their hand, get their finger on the hand button, to thank Cynthia and Aaliyah for agreeing to co-chair this. So this was an organizational meeting, so the Commission for Women staff was really doing a lot of leading this, but from here forward, this will be led by the co-chairs. So thank you for agreeing to serve in this leadership capacity, and we are very much appreciative. And I'm speaking on behalf of Chair Stitt of the Commission for Women, who officially appointed them as co-chairs. Oh, sorry, I meant to mute myself.
Well, and I just wanted to jump in. I mean, I know probably everybody in this group has served on many different commissions and committees and work groups over the years. And this is an incredible collection of expertise. And so suggestions about how to take advantage of everyone's expertise are always welcome. I know sometimes when I've been in these kinds of groups, you know, there's always a lot of information to get through and not always enough time to cover everything people want to talk about or get their issues out. So any process suggestions, I'm sure Brett and the rest of the commission staff and Leo myself would welcome that, because we don't want to miss any of the, you know, experience and insights that you all have to offer about this process. And I know process can sometimes just get in the way of getting all that expertise out there. So I just wanted to kind of be upfront about that we, you know, be mindful about our process to really take advantage of what everyone's bringing to this conversation.
Anything to add from yourself, Aaliyah?
I would say ditto, and I'll just mention that I'm currently in another state level working group. And one of the challenges that I saw is that from internally, the agenda was just set. And so for many of the stakeholders, it has been a level of a challenge and a level of frustration in not being able to participate in that agenda setting and how we kind of craft our next steps. So that's why I said ditto to what Cynthia said, is that we really want to encourage people to give feedback and share the expectations. And that was really helpful in that mindfulness exercise to really see some of the focus so that we can incorporate everyone's expectations, but also deliver on what we're supposed to deliver on, so that we can be an inclusive, collaborative, that when the recommendations make it to the General Assembly, they really are supportive in as much of a consensus as possible when presented to the General Assembly. So thank you all for participating, and I appreciate the appointment, and I look forward to working with everyone.
Thank you so much to both of our co-chairs. And yes, you will be hearing a lot less from me and a lot more from them in coming meetings.
Brett, do we need to do any next steps in terms of setting the meeting for November before we adjourn? Are we going to send out an email poll?
My plan had been to send out an email talking in consultation with our co-chairs. If there are, other than Thanksgiving week, if there are significant blocks of time where folks are unavailable, conferences, other trips, things like that, please let us know so we know not to include those dates.
Great. And otherwise, I think unless anyone else has anything to add, we can adjourn the meeting and look forward to a really productive time working together, right? Thank you, everyone, for showing up and spending 90 minutes on this topic. Really, really appreciative. Looking forward to spending a couple years together on this topic. So with that, sounds like everyone's signing off in the chat. Thank you, thank you, thank you so much.
Thank you.
Aaliyah, do we want to stay and talk to Brett for a minute about the timing of the November meeting?